how we can do just that is Middlesex Health Chief of Endocrinology, Dr. Signore. Doctor, welcome to the show. Thank you for being here.
Thanks for having me.
First off, explain to our viewers what osteoporosis is.
Sure. So osteoporosis is the most common disorder of the bone, and the structure of the bone gets weak over time, and that's what puts patients at risk for fractures.
And then if a fracture happens older in age, it's a whole other line of problems, I'm sure.
Absolutely. So we find that about 2/3 of patients after they've had a fracture never return to their actual pre-fracture way of life. And so about 20%, excuse me, of elderly patients who have a hip fracture will actually not be able to return home because of their limited mobility, end up requiring nursing home stay.
Who is at risk for osteoporosis?
So being a woman in particular, being an a postmenopausal woman puts you at risk. Patients who have low calcium and vitamin D in the diet, those who smoke or drink alcohol excessively are all at risk. If you have a parent with osteoporosis or a parent who's had a hip fracture in particular, that significantly increases your risk for osteoporosis. There are certainly medications, in particular medicines like prednisone or other steroids, that will increase the risk, and so will certain medical conditions.
And what are the benefits of a bone density test?
So osteoporosis, as you alluded to, is often a silent disease. We don't feel our bones getting weaker. So the best way to find out if you have osteoporosis is actually to have a bone density test. This is a test where they actually measure the density of the bone in the patient, and they compare it to that of a 20-year-old male or female, depending on the patient, because that's the strongest bones you'll have in your life. So this test tells us how much weaker the patient's bones are compared to a healthy average young adult.
Sure, and you kind of brought an example of that.
Absolutely. So this is looking at a bone under the microscope. This is what it would look like. This is a vertebrae, which is one of our spine bones, and you can see it kind of looks like a honeycomb.
Sure.
So it has all of these little holes. When you have osteoporosis, the bones break down faster than they can build, and so those honeycombs get much larger, and that makes the bone itself much weaker and puts us at risk for fracture.
And what are the telltale signs? I know you said it's silent, but are there anything we should be looking for?
So there really are no signs that tell you you have osteoporosis unless you have a fracture. So for many patients, the diagnosis really comes after they have that first fracture. And unfortunately, by then, we know that if you've had your first fracture, the risk of a subsequent fracture due to osteoporosis can be as high as 85%.
Wow. How can we prevent this?
So it's important to live a healthy lifestyle.
Sure.
We recommend that you're getting at least 1,000 to 1,200 milligrams of calcium per day. That can be through the diet as well as through supplements. We also recommend 800 to 1,000 units of vitamin D daily. Many patients will require more, and that can be done by a blood test to measure vitamin D levels. Exercise is very important, so we recommend weight-bearing exercise like walking, running, dancing, and also strengthening exercises like light weights or exercises that will strengthen your core muscles.
And it's important to start now.
Absolutely. Right? So we recommend really any woman or man is at least after the age of 25 is getting at least 1,000 milligrams of calcium, leading this healthy lifestyle and exercising to prevent excessive bone loss over time.
Sure. Very good, Doctor. Thank you so much for the advice. And of course, you could log on to middlesexhealth.org for more information.